Okay. So we will be demonstrating interviewing skills in this group project, and um, the contributors to this project are myself, Alejandra Mora, Marlene, Avendano-Colmenarez, and Sabrina Flores. All of us partook in script writing, research, narration, slide preparation, and the role play. And Marlene helped us with the video editing.
So, for our case example, a recently divorced mother is seeking help for her 13-year-old daughter named Diana, who is exhibiting behavioral and emotional issues after the divorce. The school reports that the girl is skipping classes and is at risk of failing the sixth grade. She shares with her mother that she's struggling to concentrate on her homework and is feeling unmotivated. At home, her mother describes her as withdrawn and isolated, mostly staying in her room, rarely joining dinner or hanging out with her neighborhood friends. And she used to enjoy playing soccer, but hasn't played since the divorce. The mother also notes that her daughter often argues about the custody dispute with her.
So our case is going to center around a 13-year-old client, Diana. Um, she is presenting with difficulty adjusting with her parents' divorce, struggling academically, isolating from family and friends, and has also lost interest in hobbies. She reports that she has very limited contact with her dad and is frequently arguing with her mom. So, based on the timeline and the emotional impact of the divorce, as well as other stressors, we identified that adjustment disorder with depressed mood as her diagnosis. We will be using family therapy modality to focus specifically on that mother-daughter dyad. And the goal of this session is to improve communication and strengthen their bond.
So our group decided that adjustment disorder with depressed mood was the most suitable diagnosis because Diana's emotional and behavioral symptoms have lasted for over 3 months, and she continues to display low mood, difficulty concentrating, and she's socially withdrawn. Furthermore, her symptoms are connected to a clear stressor in her life, which is the separation of her parents, which was absent before the life change and fits the criteria for adjustment disorder. The client's depressive symptoms are not persistent enough to qualify for major depressive disorder, as she does not exhibit at least 5 depressive symptoms daily for over 2 weeks. So our intervention we chose is interpersonal psychotherapy. This is an evidence-based approach that is often used to treat grief, loss, and major depressive disorder. It draws on psychodynamic and attachment theories, emphasizing that secure bonds are vital for survival and healthy exploration. This intervention is well suited to address the effects of interpersonal challenges related to the client's loss of a caretaker, in this case, her father, and role changes at home with this new single parent system with her mother. Loss and role changes may influence her daughter's depressive symptoms, her coping capacities, and her relationship with her mother. And so addressing interpersonal turmoils through the utilization of ITP may reduce depressive symptoms and increase the daughter's social functioning.
So in our demonstration, we will also be using 4 interviewing skills, which include empathetic responses, where you will see us, as a clinician, accurately sensing and reflecting the feelings and experiences of our client. We will help the client feel understood and validated with these responses. We will also be looking at reflection and clarification. We will be repeating or paraphrasing what the client shared with us while focusing mainly on emotions. While we clarify, it can also involve some questions or making statements to ensure that we have that mutual understanding. We will also be looking and using open-ended questions, and this will allow us to have our client get more in depth with what they're sharing and get more description. We will also be providing and maintaining focus while we facilitate our sessions. We will redirect. We will use active listening. We will set goals and track progress on those goals. And we will If needed, use I statements instead of you when the clients are speaking.
To measure Diana's progress, we're going to use a combination of self-reporting tools, tracking her behavioral goals, and also based on the parent and therapist observations. Diana's going to be completing weekly patient health questionnaires to track her depressive symptoms and her overall mood. And we'll also be monitoring her school attendance, her performance, and her re-engagement in hobbies. Um, with that being said, mom will also be providing updates as far as her behavioral and emotional changes and how that communication at home is going. And lastly, we will also be tracking her progress in session through emotional expression, her communication, and consistently following through with her goals by tracking them.
Hi, I'm really glad you both came in today. I know it's not always easy to talk about things, but the fact that you're both present today shows your commitment to work through your current challenges. Why don't we start by describing what's been going on at home?
Thank you. Yeah, I've just been really worried about her. Since the divorce, she's just not the same. She's been missing school. I'm getting calls that she's skipping class, and she barely comes out of her room when she is home. She used to be full of energy. She was always out with her friends or on the soccer field, and now she just shuts down. I just don't even know how to reach her anymore.
Yeah, I mean, it sounds like that's been a painful thing to witness, this big change, and it must be hard not knowing how to help. Do you think that's a fair statement to make, Diana?
I guess she doesn't get it. I mean, everything's so different now, and I don't even get to see my dad, and no one's asked what I want. So, no, I don't want to be bothered.
Yeah, I mean, the divorce has been challenging for you and perhaps lonely and in a confusing time as well. Do you think that your mood has changed at all since the separation?
I mean, I guess so. I mean, I don't know. Lately, I don't really find anything interesting, and some of my friends invite me to hang out with them after school, but I don't really feel up to it. I'd rather be alone, and school's just like, yeah, I'm failing, but I just can't really concentrate, and I miss my friends, but like, hmm, I just feel down.
Yeah, and to me, your mood feels like it's closely linked to the divorce. And I want to remind you that these feelings are a normal response to such a difficult change in your life. Would it be okay if I explain a little bit about interpersonal psychotherapy and how that might help you?
I guess, yeah.
Okay, so we use a method called interpersonal psychotherapy, or IPT for short. It focuses on our relationships, especially during challenging transitions like this divorce, and how it can impact your mood. So, we'll try to understand what's happening in your world, especially in your relationships, as you navigate feelings of loss and explore how they might be connected to your current emotions of unmotivation. Does that sound okay?
I guess so.
Okay. Well, one thing we do is called an interpersonal inventory. So we'll explore people in your current life, your family, your friends, teachers who are the closest to you, and maybe where there might be changes or stress. So we'll use a concentric circle. Those closest to you will fall in the very center of that circle. Those more distant and fragile connections will go on the outer circles. Would you like to give it a try?
I mean, yeah, I guess.
Alrighty. Can you think of anyone who would fall on this circle?
I guess my friend Maya, we're on the same team, but I haven't really talked to her since the season ended, but I guess I'd put her in the close circle.
Okay.
Mm.
So we'll put Maya in the middle. Thank you for sharing. Is there anybody else that you can think of?
Miss Shepherd. She's my soccer coach. I think she'd be like second circle, because she was like the only person I really trusted at first when my parents got divorced, and she was really supportive. So I kind of feel bad for distancing myself from her.
Yeah. So your soccer coach, Miss Shepherd, will go in the middle. And it seems like she offered that supportive environment that you're talking about. And you feel a slight bit of guilt, for leaving without really saying everything. Is there anybody else that you'd like to include in the circle?
Yeah, I don't know. I just hope to see her soon and explain everything. Mm, My mom, I'd probably put her in the far distance circle. Um, she'd probably be there with my dad. I don't really see him anymore.
Yeah. I mean, your distant relationship with your father was not necessarily by choice. And so I'm curious how it's been without this person in your life and what do you miss about him?
Been hard. I mean, like, my dad understood me like nobody else did, and I don't really want to talk about it. My mom's just been asking a lot of questions, and I already told her, um, I don't want to talk, and I don't know what to say, so I get mad and I yell and tell her to get away from me. I don't want to do anything. Just like leave me alone.
Yeah, I mean, navigating a significant adjustment, especially when you're trying to make sense of your own feelings while someone is asking for a response, can be frustrating. And you want time to process things, but you feel that mom is not really giving you your space.
Yeah, I mean, I don't know. I just don't want to think about it. It just makes me angry.
And feeling that way is completely understandable. It sounds like thinking about what happened brings up strong feelings. And maybe I want you to think of a recent disagreement or a conversation that you had with your mom. Can you explain a recent time?
I mean, just last night, I came out to use the restroom and she kept asking me if I ate, if I was hungry, if I texted my friend back.
Diana, I'm your mom. I care if you're hungry. I care what you're doing. It's my job to care.
So what I'm hearing is that you're overwhelmed, Diana, by your mom's questions.
Well, yeah, she's so annoying. I mean, even just now interrupting me, like, I just wished, like, I lived with my dad instead.
I mean, I care. I want to make sure you eat. I want to make sure you're okay. And you don't live with your dad. You're here with me.
Well, he should be here.
Okay, now, what I'm gathering here is that you're really missing your dad, Diana. Um, do you think that maybe involving him in these sessions would be helpful for you?
No, I don't want him in the sessions. I don't think it's going to be helpful. And he shouldn't be in her sessions.
Okay, Mom. Your intentions come from a good place, but uh, you need to acknowledge that Diana is really upset due to her dad's absence. Is that something that we can acknowledge at the moment?
Well, yeah, yeah, she's been so different since he left. Of course she's gonna act different. Like, she's not gonna be the same because he's not here, and that's his fault.
Yeah. Yeah, and that's important. You've observed some distance and you're just concerned and it's causing a lot of tension between the two of you and especially between your relationship.
But it's like, it's just an everyday thing. Like, she's always nagging at me, asking me the same questions over
Diana,
and
I'm
over
your
again.
mom. I
How are
care.
you?
It's my
Are you
job.
hungry? Do you want to go to practice?
Yes.
It's so
Do you,
Okay.
annoying. She already
Okay.
knows the
it's
answer.
my job.
Let's
Do you
slow
want me to
this
not
down.
care?
Let's slow this down. Okay, I see that this telling me the story and thank you for opening up and sharing this has uh I can see that this has made Diana a little bit upset. I want us to try relaxing. I have something that maybe we can try if Diana, if you're willing. It's called breath awareness.
That just sounds really stupid, and I don't want to do that.
Diana, she's a professional. Can you please
I
just listen?
don't care.
It's just something that maybe we can try and maybe we can even incorporate this later. We can stop if you don't like it, but maybe we can give it a try. It's super simple and it's only a couple steps.
Okay, I guess I can give it a try.
So just go ahead and sit up straight in your chair and um, you're just going to get in a comfortable position. We're going to try this for a couple minutes, okay? So Diana, just release any unnecessary tension in your body and just slowly bring awareness to your breath, okay? You don't need to change anything else. Just observe your breath, okay? You're going to observe any movements or any
Mhm.
sensations that you feel every time you inhale and every time you exhale, okay? Let your attention travel with the air passing through your nose, your throat, and into your lungs, okay? And I want you to focus on the expansion of your chest and your belly, okay? And we can do this for a couple minutes or until you feel comfortable or a little bit more relaxed, okay? Okay, Diana, thank you for trying that. I do see and notice that you are a little bit more relaxed. Maybe you can share how that felt for you or how you feel right now.
Yeah, I mean, I do feel like my chest is less tight, and I do now see I did kind of overreact slightly, so I apologize.
Okay. And that's really admirable of you to apologize to your mom. That takes a lot, and I appreciate you taking that step.
Okay, so before we close for today, let's just slow things down for a little bit, and I want to check in with both of you. A lot came up in today's session, and I don't really want to push past it. So, Diana, first of all, I really appreciate how honest you were today. You shared some things that I know that they weren't easy to say out loud, so thank you for that. Um, and mom, thank you too. I know it's uncomfortable and you're trying your hardest even when it feels like you're just getting a lot of pushback. But the fact that you're still here and putting in your effort and time, it shows a lot. And I hope Diana can see that. Diana, can you acknowledge the effort your mom is putting in to support you?
I mean, yeah, like I do appreciate her for initiating this. I know it just means that she's looking out for me and stuff like
Yeah,
that.
yeah, she is. And I know things are still really tense between you guys, and that's common when big changes happen. Diana, you mentioned how some of the questions your mom asks are, repetitive and they make you feel pressured. So mom, I want you to take that into consideration and realize that just because I know you're coming from a place of caring, but it doesn't always come off that way to your daughter. Um, so something we do in IPT is we talk about how changes in relationships like divorce, or other big changes can cause tension. And then, that causes some confusion about the different roles in families, and in different relationships. It just seems like right now you guys really are you guys are trying to show up for each other, but you're not understanding. So we're gonna work on that communication. Um, something I would suggest is homework. It's nothing big, but for Diana, something I would like you to do is every day I want you to write one thing down that you wish your mom could change or understood. It could be something small or big, and you don't have to share it, just hold on for it until next session. Is that something you're able to do, Diana?
Yeah, I can do that.
Okay. So I want you guys to try this week. It doesn't need to be perfect, just practice it. Um, that small change is going to make a big difference in your relationship because it's going to help you learn how to communicate in a new way. And that takes time. Before we wrap up, is there anything you want to say to each other or anything you might want to ask me? Diana?
No.
Okay. Mom, what about you?
Um, I'm just excited to try these new tools to see if this maybe will help us in our relationship.
I'm excited to see it too. I really think it is going to make a difference. We're going to check in on that next week and talk about what worked, what didn't, and then we'll keep building from there. I know today was hard and there was a lot of difficult conversations, but you guys did great and honesty was a big part of that. So thank you for doing that work and taking the time to open up. So I will see you guys next week if you guys don't have anything else for me.
Thank you.
Thank you.
Thank you.